Assalamu alaikum. Good morning. How you all doing? This is an introduction to clinical skills in your ophthalmology clerkship. And what I'm going to do here is present an overview of what's already mentioned in your clerkship manual. And I have hope that by the time you are seeing this video, you've already gone through this bit that explains to you how to perform clinical skills. Now, because we are in a situation where I cannot directly interact with you in a clinical setting to demonstrate a clinical skill. So what I am going to do, or what the clerkship has decided to do, and this credit goes to the clerkship director, who is Dr. Amna Masroor, to create some instructional videos. And the idea is that you can follow the instructions in the clerkship manual and see those instructions being done by your clerkship team, and then you can practice them at home. Because contrary to what you might think, almost all of the methods that are specific to ophthalmology, i.e., something that you really don't get to practice or do anywhere else, although some of them you should be, but generally you don't, you can do at home because you don't require any specific instruments. Even something like visual acuity can be done at home. Simply you need to do is print out a visual acuity chart. And although it might not be very accurate, it is something that can be practiced. The only exception maybe is ophthalmoscopy, because I'm sure many of you don't have an ophthalmoscope. So that is one skill we can concentrate on once you come back to your regular teaching schedule. But for the rest of the skills, it's very easy to do them at home and practice at home. And since nobody's allowed to go out anyways, officially, you have a lot of time to practice. So we'll have videos of most of the skills that you learned during your ophthalmology clerkship. But before that, I'm just going to tell you the basic components. And this will help you not only in ophthalmology, but basically everywhere you perform your clinical skills, because the steps or the components of all clinical methodology is pretty much the same across all the disciplines. So there are basically 7 components to a clinical skill, and the first one is a prerequisite. Prerequisite is something that makes sure that when you are going to perform a clinical skills, you have everything at hand, and you're not going to be fiddling or running around trying to find something in the middle of a clinical skills, which is really not very professional, simply because your patient would think you have probably never done it, or you are very careless, or you're not paying attention to the patient. So this is something that you must be fully prepared for before you even start off on doing a clinical skill. And some of the examples are, do you really have a Snell's chart in the area where you want to do visual acuity? Are you going to be taking a patient around various places to find a Snell's chart? Do you have a torch at hand? Because many clinical skills in ophthalmology, torch examination, pupillary examination, depend on you having a torch, and sometimes more than a single torch. And more importantly, does your torch work? Are the batteries any good, and the illuminated, the bulb is functioning or not? So you don't want to be fiddling with the torch. Make sure your torch works before you start your clinical skills. Because when you ask your preceptor, or you tell your patient, "Meri torch nahi kaam kar rahi," or "My torch doesn't work," or "Just give me a second, let me make it work," again, not very professional, and not something you really want to do. Because imagine taking something like your car to a mechanic, and he says, "Hey, let me just go find a screwdriver," and you're thinking, if he doesn't know where a screwdriver is, how is he going to work on my car? So your patient is going to think, if he does not know where the torch is, or even worse, how to operate the torch, he's going to lose faith in you very quickly. And your nails must be clipped. Many clinical skills require direct physical contact with the patient's eye, and you don't want to be jabbing your nails into the patient. In fact, unless your nails are clipped, you should not be in the eye clinic. We have a nail clipper, or a nail cutter, what you might call, so we can give one to you, loan one to you, so that you can clip your nails and return it to us. But in an assessment setting, in an OSCE or a mini CEX, you can read about mini CEX in your clerkship manual. If your nails are not clipped, that implies basically not getting a satisfactory score, or a score at all in your assessment. So make sure that you are fully prepared, and all of the clinical skills that are listed in the clerkship manual do provide what you require or they do mention what you require to perform a certain clinical skills, even mentioning that your nails need to be clipped wherever appropriate. Your nails should always be clipped generally. So once you're prepared to do your clinical skills, the other thing to do, the second component, or the second step, is to greet and to ask for permission to perform the clinical skill. This is so important because, in my opinion, communication skills is the most important competence that a clinician has right next to his clinical competence. In fact, it's just as important, because unless you can effectively tell your patients what to do, or in terms of when you're examining or when you are telling a management plan, you haven't succeeded in passing your knowledge, or what you have been trained for, effectively to your patient. And that means that you're not doing your job properly. So this is something that's so essential to do properly. And I'll just show you two videos as to how simple it is to do this. And it takes hardly any seconds to complete this process. So let's just see a video in which two videos, they're contrasting videos with regards to how to, and in our country it's not that difficult, because we don't really are in a situation where we shake hands because of cultural necessities. So it's really not difficult. So let's just see these two videos. अस्सलाम वालेकुम, मेरा नाम डॉक्टर अली है। आज मैं आपकी करीब की नज़र का मुआयना करूंगा। मुआयने के दौरान मैं आपको एक चार्ट पकड़ाऊंगा जिस पे लिखे हुए हरूफ आपको पढ़ने को कहूंगा। इस दौरान आपको कोई दर्द या तकलीफ नहीं होगी। क्या आपकी इजाजत है? So this is how easy it is, 5-7 seconds to greet and tell the patient what you're going to do and ask him if he allows you to do it. Let's just see what this one does. अब आपने करना ये है कि अपनी दाईं आंख को बाएं आंख की हथेली से बंद करना, और इसको अपने हाथ में पकड़ के जहां पे आप रख के पढ़ना चाहती हैं, आमतौर पे जहां पे आप रख के पढ़ना चाहती हैं वहां पे रख के देखें, आपको ये जो आखिर में लाइन लिखी हुई ये नजर आती है। Okay, so the difference, the doctor in the second video, the doctor in the first video, they're both the same, but the second videos, there is nothing wrong with the tone of communication or the quality of communication, but a very big part in which a patient actually knows what's going to happen is missing. And it doesn't take long for a doctor or a student in your situation to tell your patient what you're going to do. And this is a very, very important step in developing your professionalism, and also a very important step of clinical skills. You do lose marks if you don't do this appropriately. And although the score might not be significant, but it is still something to really practice and nail down, because the better you communicate, the better your patients would feel, the better you'll feel in the long run. And this is something that's really essential to get right. And as you will see, communication is something that's going to be important in all of the components of the clinical skills. So we did prerequisites, and we did greeting and consent, and then what we are going to do is explaining what you're going to do prior to doing it. In the previous video, the doctor was explaining to the patient to read the chart properly. He could have just not done that and given the chart, okay, padhe. The patient would have probably read the chart, but he would be thinking, why am I doing this? What am I supposed to do? Where am I supposed to start from? So let's just see another video. And this is so especially true if you're going to make a physical contact with the patient. And in our country, especially in our country, if the genders are opposite, it creates a little bit of a faux pas, or a situation in which either party might not be very comfortable if it is done inappropriately. So let's just see how to ask for, during a clinical examination, even though that you have taken a general consent first, now that you're about to specifically come in physical contact with the patient, you're telling the patient, because it's important, because the patient is usually not expecting a contact, especially in an eye clinic setting. And if you're doing it, you should definitely tell your patient. अब आपने ऊपर छत की तरफ देखना है। मैं अपने हाथ से आपकी आंखों की पलकों को थोड़ा सा हाथ लगाऊंगा, आपको दर्द या तकलीफ नहीं होगी। ठीक है, क्या आपकी इजाजत है? आपको यहाँ कहीं दर्द तो नहीं है? ठीक है, मेक श्योर आप सीधा ऊपर देखें। की तरफ देखना है, मैं अपने हाथ से आपकी आंखों की पलकों को थोड़ा सा हाथ लगाऊंगा, आपको दर्द या तकलीफ नहीं होगी, ठीक है? क्या आपकी इजाजत है? आपको यहाँ भी दर्द तो नहीं है? ठीक है, मेक श्योर आप सीधा ऊपर देख. See how easy it is to actually ask a patient, and it's not an impossible thing. It's a very easy thing, and all of, and it's something that you really don't need to learn. It's right there in your head. You just need to bring those words out to your mouth in a way the patient can understand. So let's just see what happens. Or you can also do this. And use your thumb to gently, from the lid margin, pull the lid down. You don't have to press too hard. So without telling the patient, a physical contact was made. This is not right. This is something that the patient might not appreciate, even if the patient does not say anything, or in a worst case scenario, really make a lot of human cry. I still remember when I was doing my house job, one of my seniors was examining a female patient in one of the clinics, and we heard a scream because the patient said he touched me and I wasn't expecting him, and he was just doing, I think, lymph node examination of either it was a preauricular or the submandibular lymph nodes. I don't remember right. And there was a pretty loud scream, and it's not right. It's very important to appropriately tell your patient what you're going to do, especially if you're coming in physical contact. And again, this is your this is your communication skills that are coming into play here. So now that we have done our prerequisites, we have greeting and consent and explain to the patient, the next step is to instruct the patient. How is this different from explanation? Explanation is something that you are going to do. Instruction is what you expect the patient to do. And you do it in a language that is very easy for the patient to understand. And you don't use jargon here to show how well you know your field. The best way of actually communicating how well you know is to simplify as much as possible so that your patient understands. It's just like, I'm not boasting here that in the ophthalmology clerkship, our biggest challenge is to make things so simple for undergraduates so that they can understand it. I'll narrate a little incident. When I was in final year and I was examining a patient of hypothyroidism, I was asked to explain the ECG, and I really couldn't tell what was wrong with it because I was seeing the normal waves that you see. And my preceptor or my teacher who was taking the ward round was, first he had this sarcastic grin on his face, and then he started admonishing me, you don't know how to read an ECG, Manika. This is the first time I'm examining a patient of hypothyroidism, number one, and I apologize for not being prepared for it, but can you please explain what's wrong with this ECG? And he said, this is a low voltage ECG. And I said, okay, yeah, now I see it because it's like small. And then he told me that I asked him, oh, why this is a low voltage ECG? And he said, it is just because it is. And I said, it's very difficult for me to remember just by you saying it's low voltage and hypothyroidism. He said, oh, you remember this, that this doctor on this date told me that in hypothyroidism, it is possible to have a low voltage ECG. Well, I didn't continue the discussion or argument from there onwards because I knew he probably doesn't know. And he couldn't explain to me. And the only reason I remember this is because this incident is just sort of locked in my mind. So the reason what I'm trying to tell you here is to simplify. Our job is to simplify things for you, and hopefully we are doing a job that's working to an extent, because ophthalmology, although it's really small, it does use some very specific terminology, that's not very common in other specialties. So your job when you're examining a patient is to tell him what you want him to do or her to do in a way that's as simple as possible, in a language that is as simple as possible. Use everyday words. Don't use words that are very specific. For example, lateral dekhen, superior dekhen, medial dekhen. They won't understand this. Even very well-educated patients would have trouble understanding, what do you mean lateral dekhen? Does he want me to, or she wants me to do some lateral thinking? So use बाहर देखें, ऊपर देखें, नीचे देखें, दाएं देखें, बाएं देखें, नाक को देखें, सर की तरफ देखें, पैरों की तरफ देखें. I mean, some things that a doctor might think are very natural is because he's been trained that way, but you need to understand your patients are not. And One very important thing, you don't command your patients. We were when we were in final year and we were being instructed on clinical skills, we were told command your patient, and that was like, in a way, आप ये करें. You don't do that anymore. You instruct your patients, आपने ये करना है. So you don't tell your patients in a commanding attitude. You tell your patients in an instructive attitude. It does make a difference. And you'll see many doctors as you move through your clerkships, and you see them interact with your patients, and you'll learn how command is different from instruct, because not every clinician, especially those who were trained long ago, are still in that command mode thing as compared to instruct mode thing. Then finally, you get to a stage where you're performing your clinical skills. So you have your prerequisites, you have greeting and your consent, and you have explained to your patients what you're going to do, especially if you're going to come in physical contact. You can also come in once you are performing your clinical skills if the physical contact bit does not start at the beginning but starts somewhere in the middle, as you saw in that video. So the explanation bit can come anywhere, but generally it's at the beginning as well, because you have to explain something as to what you're going to do. Then you have your instructions to your patients as to what you want him to do. And then finally you perform your clinical skills. And the more you perform, the better you'll get. And when you're performing them, you have to pay attention, or you practice with attention, so that your mind can go into something called metacognition, so it can learn from your learning by developing a skill called analyzing your thinking. But simply, when you are practice with open eyes and an open mind, so that the input can result in improving your skills. Then it comes to interpretation. Interpretation is simply, you did a clinical skills, and you did a clinical skill because you wanted to find out something about your patient. And now it is time to figure out what was the interpretation of your clinical skills. And remember, the eyes cannot see what the mind doesn't know. And my story about me not knowing what a low voltage ECG is, when I was looking at it and it was right there and it was smaller ECG, but my eyes couldn't see it because I didn't know that this thing existed. So this thing is so important, that once you're interpreting things, you should have enough of a background knowledge about what you're looking at in order to actually see it. So this is the last component of your clinical skills, which is conclusion and salutation. And this is basically, begins by you describing your findings at an undergraduate level. You are asked to describe your findings to your preceptor. Your preceptor is a teacher who is taking your clinical skills session, and not to your patients. And the simplest reason is you're learning, and everybody who is learning is expected to make mistakes, because this is a very safe place. Your clerkship is a safe place. It's all under supervision. And if you make mistakes, there are people around you who will correct you. And this is the time to learn. Your learning is not in your house job. Your house job is application of your learning, and then you under supervision, but application of your learning. And then beyond that, you are supposed to, once you've done your house job, you are supposed to be let go in the wild and be family physicians or general practitioners. So it is at an undergraduate level, you describe your findings to your preceptor unless otherwise instructed, which is very rare. And the reason is that you might say something to a patient that might alarm him. Maybe you would say that he has a cataract when he doesn't, or even worse, he's had refractive cataract surgery done, and you say he has a cataract, and he'll be thinking, I've had cataract surgery done. Where's this cataract coming from? Do I really have a cataract again after cataract surgery? Should I go back to my doctor? Should I see another doctor? It's just like the story I narrated about the low voltage ECG. And had I told the patient directly about his thing, aapko kuch bhi nahi hai, then he would think, why am I in the hospital? Why does everybody else keep telling me कि ये ECG ठीक नहीं है? So you're instructed to tell your findings to your preceptor so that you can learn from it. And because your patient was there and helping you learn, you show your gratitude by thanking your patient. So this is an encounter in which the doctor is explaining the findings to the patient, and also appropriately showing his gratitude.
ठीक है, आपका बहुत बहुत शुक्रिया। इस टेस्ट के बाद हमें ये पता चला है कि आपकी करीब की नज़र एक आम इंसान के मुकाबले में, जहाँ पे आप रख के पढ़ना चाहती हैं, कम है। इसकी एक वजह ये भी हो सकती है कि आपकी करीब की ऐनक का नंबर तब्दील करना पड़े। अगर उसके अलावा भी आपको नजर ठीक नहीं आता तो इसका मतलब है कि आपकी आंख का मुआयना करके देखना पड़ेगा कि ऐसा क्यों। कोई सवाल आपका? आपका बहुत बहुत शुक्रिया।
All right. So after that, we'll post some videos of clinical skills that can be practiced by you at your home, and they're in the same sequence as was provided to you in your schedule. I hope this was useful, and this will become even more useful once you start reading about these skills and practicing these skills, because this serves as a reference point so that you know that these are the 7 components and these are in your mind at an interplay. And as you saw, the most important competence you develop here next to your clinical competence is your communication skills. So work on your communication skills, especially in these days where most communication is textual rather than verbal. Sometimes the proper words don't come to your mind and you have to train yourselves. But you guys are way better than we were, because the changing times have led to a scenario in which you are more open with the way you express yourselves, and you have greater tolerance for respecting others' ideas. So it will be easier for you to sort of imbibe this rather than it was for the generation before us, especially, and to an extent our generation. But you need to be able to be using the appropriate words at an appropriate time, so that your patient knows that you are caring for him and you knows that you know what you are doing. Thank you very much, and I will see you soon.